Sacral torsions. So if the sacrum is stuck in a position relative to the inanimate, we have a sacrum torsion or a sacral torsion. The video that I put out before that hopefully you saw talked about right on left, left on right, right on right, and left on left sacral torsions. So the idea is we're basically using muscles to pull the sacrum into a better position relative to the bones around it. So the first one that we're going to do is with the piriformis. The piriformis connects to the front side of the sacrum in here. And so if this right side of the sacrum is stuck back, the piriformis will pull it forward. So with this, you're going to have the patient lie on their asymptomatic side. So painful side up. You could lay on your left. So in this position, I'm going to have her bottom leg somewhere between 60 and 90 degrees of hip flexion. But the most important thing out of everything is where this top leg is. I'm going to use my fingertips to palpate medial to the PSIS so I'm right on the SI joint. And I'm going to slowly start to flex her hip until I start to feel motion at the SI joint. And in this position, I'm going to then start with her leg down, adducted. We're going to slowly abduct it or bring it away from midline until I start to feel that little bit of motion that I feel right now. Now in this position, to activate her piriformis, I'm going to slowly let go of her leg and I'm going to have you hold it up. And we're going to do 3 to 5 holds for 3 to 5 seconds. Relax. Now in this position, she's holding her leg up against gravity. So I could push down, but I don't even really need to, since we're just trying to get the piriformis to activate. I'm going to keep palpating this area, and I'm going to see if I can take the leg any further before I feel some motion, right about here, about an inch, inch and a half higher up, and hold your leg here again. Again, holding for about 3 to 5 seconds. Relax. Bring the leg up a little bit again, right about there, and again, hold here. Good, relax. So after 3 to 5 repetitions of that, hopefully what we can do is reassess what we were looking at and see a change for the better in terms of joint alignment, joint mobility, pain, motion of the lumbar spine, something along those lines. Now, the other muscle energy technique that we can do for this sacrum is basically with the erector spinae. Now, since the erector spinae connect to the base of the sacrum, they will rotate the sacrum back on whatever side we're activating the erector spinae at. So with that said, this position, we're going to have the patient on their side with their symptomatic side up again. And we're going to have both hips flexed until we start to feel motion at the SI joint. And then we're going to rotate both hips to bring the feet up towards the ceiling. And in that position, I'm going to basically have her hold her feet up, and that should activate the erector spinae to hopefully pull the sacrum back at the base on the top side. If you could lay on your left side again. So again, I'm going to go medial to the SI joints, or the SI joint on the top. So I'm on that, or medial to the PSIS, so I'm on the SI joint. And I'm going to flex and extend both legs passively so I can feel where she starts to move, which is right about here, which is about 45 degrees of hip flexion. And feeling this joint, I'm going to start to rotate both legs up and right around in here. It's not very far for her in this position on this side. I'm going to have her hold her feet up. And we're going to have her hold that for 3 to 5 seconds. She can relax. I'm going to rotate her feet up more if I can until we start to feel motion right about there. Hold it again. 3 to 5 seconds. Relax. And again, try to rotate her more. And one more time, hold there. So after 3 to 5 repetitions of this, we're going to reassess her pain, her motion, her alignment, the SI joint mobility to see if it was successful. If it wasn't, again, we're going to do a different treatment, whether we're going to look at doing a muscle energy technique of the pelvis on the sacrum or something else to the lumbar spine. Because many times if the lumbar spine is not moving properly, the SI joints will be a little bit tighter due to those muscular connections between the two.